Hi, I'm Josh Lynch. I'm an emergency physician, a professor, an addiction medicine leader, and the founder and chief medical officer of Matters. Matters exists because every day patients with substance use disorder show up ready for help, and the system still fails them. Not because we don't know how to treat addiction, but because we don't have the infrastructure to reliably connect people to care when it matters most. Sadly, I know this reality personally. Despite strong family support, my brother-in-law and uncle both died from opioid overdoses. I represent the end user from a clinical perspective. I guess you could call me the hipster on the team. I practice emergency medicine. We see the realities of the addiction crisis every day, its impact on people and communities, but as physicians, we often lack the tools to make a lasting impact. I see clinicians struggle with the fragmented referral process, outdated resource lists, manual phone calls, and no closed-loop confirmation that a patient actually got the help that they were seeking. Unfortunately, substance use disorder doesn't get the same attention as other disease states because of stigma. We often hear the phrase, "nothing about us without us," as a slogan to promote person-centered change that honors lived experience. Just as any solution needs to consider the lived experience of people who use drugs, we should also consider the clinical end user. If a tool adds friction, clinicians won't use it. Matters was designed by listening to the needs of patients, physicians, nurses, peers, and treatment providers, and then rebuilding the entire referral process around how care actually happens. Matters works because it respects time pressure, workflow, reality, and patient urgency.
My name is Mila Pahomova. I'm the Associate Director of Operations for Matters, and I serve as the technical lead, the hacker for the team. I own all operational aspects and development of the Matters referral platform. My role is to assess operational needs and challenges, create solutions, and incorporate them into the application. I work directly with a team of contractors to develop new features, define requirements, test functionality, and ensure the platform operates reliably and securely across our partner network in sectors such as healthcare, community organizations, law enforcement, and more. This work includes all aspects of the platform, from how referrals are initiated and what information is captured during the referral process, to the flow of data between partners, how users interact with the system, and how sensitive health data is protected. Meeting the community's needs and ensuring a positive user experience are my top priorities. If the platform isn't intuitive, quick, aligned with our partners' real-world workflows, and effective at meeting patients' needs, it won't be used, no matter how great the idea is. We continually challenge ourselves to refine the system to better serve those who depend on it most. The Matters platform is not just a piece of technology. It's a bridge between people and the care they need, designed to simplify processes, close gaps, and make meaningful connections to treatment seamless and person-centered.
My name is Kimberly Bolden. I'm the Director of Matters and the Business and Strategy Lead, the hustler, if you will. Operationally, my focus is on sustainable partnerships and scale, but I never lose sight of the people at the heart of each of our interactions. This is not a pilot project. Matters has proven successful in bridging gaps in care for patients seeking treatment for opioid use disorder. But as a team, we know we can expand this initiative. Substance use intersects with other stigmatized disease processes and societal needs. Matters is designed as shared digital infrastructure. To date, our purchasers have been hospitals, health systems, and public agencies, although I intend to get creative as we explore other applications, such as to facilitate care during transitions, like from correctional facilities. Our end users have been patients, clinicians, care managers, and peers, but I can see us getting creative here too.
Our team has worked together in high-pressure healthcare environments for years. We've built Matters while managing clinical shifts, operational constraints, regulatory requirements, and limited resources. That experience has built discipline, resilience, and trust. We are not coming to this challenge with a fixed mindset. We are here to be coached by fellow leaders in the field. We see the value and outcomes on the OUD-specific platform we have built, and we're ready to develop a go-to marketing strategy to expand our platform beyond OUD and to manage the complex reality of this work. We are ready and excited to fully engage in the 6-month mentorship process. We have structured our professional responsibilities to make that commitment real. Matters sits at the intersection of evidence-based treatment, real-world clinical need, and scalable digital infrastructure. We believe entrepreneurship is how system-level change actually happens. We started Matters with a narrow focus and set out to prove product-market fit. Now that we've established success, we owe it to the profession and our communities to expand to other disease processes to advance holistic care. We're excited for the rigor, mentorship, and accountability of this challenge, and we're ready to do the work. Thank you so much for the opportunity.